Okay, everyone, I think we're back. Thanks for your flexibility. Angela, can you?
Can you hear me?
Yes, this is so much better.
Yay. Oh, wow. Okay. I could just keep going.
Yep, I think you're good to keep going.
You have to enable, I think.
Yep. Yes. Let me give you permissions real quick.
Thank you, Kat. I didn't know what I
No,
was
it's fine.
getting through there. Okay. How does this look?
There it is. You're good.
Thank you all so much. It happens, right? Technology. So
Technology.
bariatric surgery in Black women, I was talking about the disparities and the differences between non-Hispanic Black, looking at the 76.1% versus the 69.8% found in white individuals. So a difference there in the percentage seen between obesity and overweight populations. And what I love about these slides, this is where I left off, was regarding the CDC doing these color slides. So you can actually see the differences and how these states are just getting darker. So as you go from 2011 all the way to 2019, you could see the states are just getting darker and darker, which means that people are just gaining weight. And unfortunately, more people are being diagnosed from overweight with overweight and obesity. So this ends, as you can see, it just gets darker. I think the only state that held on was Colorado. And I think people in Colorado maybe are perhaps more fit. They still had at about a 20 to 25% population suffering from obesity. But if you see here, by 2019, we have a large percentage of the United States with more than 35% of the population suffering from obesity. So why is this important? We know that obesity is disproportionately affecting minority populations. In self-reporting, non-Hispanic Black adults are at about 40% rates. Hispanic adults are self-reporting at about 34%, compared to non-Hispanic white individuals who are self-reporting at almost 30%. So these are some differences. Of course, obesity in itself, which most of people know, it's not just about looks and a lot about how you feel, but it's also related to a lot of medical issues. So high cholesterol, stroke, people with obesity normally suffer from bone or muscle issues because of the weight they're carrying. High blood pressure, which again can relate to stroke, can relate to sleep apnea. There are cancers that can be related to obesity. And of course, a higher mortality rate. So my particular interest is regarding obesity, but more specifically, obesity in Black women. So Black women are known to have the highest rates of obesity within the United States. And consequently, of course, because of these higher rates of obesity, Black women then suffer from those higher rates of other comorbidity issues, such as diabetes, hypertension, and heart disease. So I don't know if you noticed this, but from that slide with everything going on, I wanted to just go back if you saw this 80.6. Big number, right? So what this is saying is that 80.6% of non-Hispanic Black women within the United States are suffering from either being overweight or obesity. So again, a large number to tackle. Bariatric surgery. So this is thought to be a great solution for treating obesity and morbid obesity. When we talk about bariatric surgery, we normally refer to the adjustable gastric band, also known as the brand name of one that most people are familiar with is lap band. There is the sleeve, and then the more common one that's been around for a long time is a Roux-en-Y gastric bypass. So over 70 million Americans have been found to be suffering from obesity. In 2016, though, only 216,000 people underwent bariatric surgery. So if you think about this, right, such a big difference. 70 million suffering from obesity, however, only 216,000 actually getting surgery. And what we also find is that of those who do get surgery, white individuals are the majority population. Even though we just saw in previous slides that minorities and non-Hispanic Black and Hispanic individuals actually suffer more from obesity. So if you think about those differences, there's a large discrepancy. So why is that? So very few studies have looked into this. There was a 2007 study that actually looked at Black women that did focus groups and that found women say that they limited the resources to have bariatric surgery. They lacked the time. There were issues regarding control and fear. And there were also some issues regarding outside perceptions. Outside of that, there was a study done this year. Actually, it looked at minority. The population of this study was majority female and Black women. And they did semi-structured interviews and found that there was a stigma associated with obesity, that people who went under bariatric surgery were thought to were lacking the willpower. They were thought to be lazy. A bariatric surgery wasn't considered socially acceptable, that they should be dieting and exercising. And they thought that bariatric surgery was considered like a shortcut to weight loss, and they actually almost like needed to earn it. So it was very interesting to see the reasons why they had not pursued bariatric surgery. So what I did then, in taking all this information, I was interested in looking at people who had completed bariatric surgery to see what their experiences were and that process that they went through. This was a qualitative grounded theory. It was a mini study. We had 5 individuals. So we used grounded theory because this theory seeks to develop a model and comparative analysis in what these women said. And what we were looking for was this underlying process they went through, that they shared, this experience they shared in getting to bariatric surgery. Again, we used interviewed 5 women via Zoom, just like this. Professional women, they were all about middle age, and they self-identified as Black. And the figure here on the right actually shows that grounded theory framework on how you get the purpose of sampling, and you collect that data and the coding that comes from that. So after I did these interviews, I uploaded the transcripts into a system called In Vivo. These again were Zoom interviews. They were transcribed by Zoom, had to go up and clean it up a little, brought it into In Vivo, and then analyzed the data. Did comparative analysis to see what those common underlying themes were. And what we found were 15 initial codes. I didn't put them all here, but some of them included mental health. Some of these women had experienced depression related to their obesity. There was a time of contemplation where they considered bariatric surgery and they had to do their own research on it. Their initial encounters with the surgeon and whoever introduced bariatric surgery to them was a large factor in getting it done. And they all pretty much also experienced a delay in scheduling the surgery for various reasons. These were then further developed into 4 intermediate codes, having a lack of internal confidence, lack of social and external support. We found that social and external support was also important, the support that they did get. And again, seeking out that information for informed decision-making was a common theme. So what does this all mean? So again, we know there's an existing unrealized barriers and facilitators overall regarding the treatment of obesity. And again, bariatric surgery has been found to be an effective long-term solution, but again, there's barriers and facilitators for minorities in getting that done. There is a need for improved utilization of bariatric surgery, especially among Black women. So from the themes we've have found so far, there is need for further support and education to mitigate these disparities. And ultimately, the hope is that we can increase the use of bariatric surgery. And by doing that, we could decrease the comorbidities and therefore increase and improve the quality of life experienced by these women. So from here, I would like to conduct a larger study to reach saturation of the data, further work the theoretical coding, and then model development, and ultimately hope to disseminate this information to clinical practice to help, again, increase utilization of bariatric surgery and improve overall quality of life. So these are my references. I really appreciate your time. I'm glad we were able to figure out I really wanted to share this, so thank you.
Thank you so much, Angela, and thanks to everybody for bearing with us with these technical difficulties. Does anyone have any questions?
Yeah, I got a quick question. Angela, we appreciate you. Thanks for your patience, and thank you for your presentation. At the end there, I saw, you said further education and support is needed. What would be some examples of that? Like how could help start coming in that way?
That's actually a great question. So there was some false information that some women had regarding how to get the surgery done, the process that was needed, insurance coverage, the time taken away from work. And a lot of them experienced difficulty because there is a process to get surgery done. You'd have to have like nutrition visits, cardiology clearance. And the women I spoke to had difficulty in getting time off work, childcare to get those clearances done. So supporting in a way that they could get those requirements from insurance done in a way that allows them to have bariatric surgery. A lot of them, even if they started, would stop in the middle of the process because of how difficult it was to get through those hoops. Part of it is insurance requirements for whatever reason. So I think part of it is also going back to insurance to find out, are these necessary? How can we improve this process for them?
Cool. Thank you so much.
Definitely.
Hi, this is Gabriella. I just have a quick question. How do you feel about maybe trying to partner with different doctors, like maybe general practitioners or something of that nature, to kind of get more information out about this type of procedure?
Yeah, that actually makes sense, Gabrielle, because a lot of patients don't know, where to go, where to start. So you're right. I think if we do start at that primary care based level to get information out, it's interesting. Some research shows that not all primary care providers are even suggesting it to their patients, which I think is a good point. I think that you're raising is that even the person who starts the referral process isn't even starting it, or they try to make judgments about the patient if they'll go through with the process. So I think, yeah, if we start at that ground level, then hopefully we can get better recommendations and referrals out there to push patients through the system. So I think that is it's a grassroots, starting from the beginning to get it started.
Thank you.
Thank you.
Are there any more questions? Okay, so
Thank you.
our final speaker is Ms. Kathleen Wilson from Bayer School of Natural and Environmental Sciences. Her faculty advisor is Dr. Brady Porter, and her presentation topic is assessing water quality in the Buffalo Creek watershed via fish community surveys.
Thank you. So I'm going to share my screen. All right, can everybody see this?
Yep.
Okay, great. So the project I'll be sharing with you guys today is titled Assessing Water Quality in the Buffalo Creek Watershed via Fish Community Surveys. And I'm a master's student through the Environmental Science and Management program that is through the Bayer School. And my principal investigator is Dr. Brady Porter. So just to briefly run through what I hope to accomplish in this meeting, I want to introduce the Buffalo Creek watershed to all of you, and then talk about my goals and objectives in this project. Then I'll review my methods, talk a little bit about my results, which are fish survey results and Ohio Index of Biotic Integrity results, and then I'll summarize and talk about future directions. So the Buffalo Creek watershed is a watershed that drains 171 square miles from Butler, Armstrong, and Allegheny County into the Allegheny River. This comprises of 348 miles of streams, and these streams have designated uses according to Chapter 93 of the Clean Water Act. These are color-coded in the map to the right here. So in teal, up in the top portion, we have high-quality cold water fisheries. In light blue, we have high-quality trout stocking fisheries, which comprises the majority of the watershed. And at the bottom, in dark blue, we have 9 miles of trout stocking fisheries. And that's the main stem that enters into the Allegheny River. And so according to the Clean Water Act and those designated uses, the Pennsylvania Department of Environmental Protection goes around to these streams and assesses them and gives them ratings of attaining or non-attaining based off of the criteria that they follow. And so in this talk, I'll be calling non-attaining waterways impaired waterways, which is essentially what they are. These waterways are impacted by pollution, and these pollution sources in Western PA are and in this watershed are abandoned mine drainage, agricultural influence, natural sources, and on-site wastewater, as well as about 26% of these impaired stream miles being due to unknown pollution sources. And thus, conservation efforts were initiated by the Audubon Society of Western Pennsylvania. And so my goals here were to try and see how this pollution is affecting fish communities by using the characteristics of fish communities to infer about water quality. My objective was to conduct fish electrofishing surveys and analyze these results through biotic indexing for comparison between historic fish surveys to assess water quality in the watershed. Then I compare historic data to more recent data to detect changes. So why did I choose a fish community? Well, fish serve as bioindicators, meaning their status in an ecosystem can be used to assess ecosystem health. So knowing certain species and knowing whether they're present or absent in the watershed can tell me how healthy the stream is and what the water quality conditions are. Some of these characteristics that we follow and look at are pollution tolerance, breeding behaviors, feeding habits, preferred temperatures, and pH tolerance. So from these fish community characteristics that we know about, we'll go out into the field and conduct electrofishing surveys. I conducted 5 electrofishing surveys from October to November 2021. All of these surveys and their locations were based on 2013 PA Fish and Boat Commission unassessed waters surveys. So I went to the same locations that these were conducted at. And after we conducted these surveys, I then calculated Ohio Index of Biotic Integrity, which is our biotic indexing. So what is electrofishing? Electrofishing begins with an electrofishing backpack, and this backpack can be used to create an electric field in the water, which briefly stuns the fish. When the fish are stunned, we can collect them using dip nets and our 8x8 foot seine, and then we can store them in aerated containers until 100 meters of stream have been surveyed. Then we identify, count, and release these fish. So with that data, or actually, sorry, first I'll talk about the fish survey sites that we went to. So just for reference within the watershed, we were looking at Central Buffalo Creek, which is highlighted in this light blue color. And then the black dots are the sites that we went to. These are the names of the sites, just in case you need reference to where they are within the watershed as I continue on in this presentation. So after we conduct our electrofishing surveys, I'm able to look at the fish community. And I do this by organizing us into a table, as you see here, with a species list that's allocated by family, and then the site locations at the top separated into columns. And the takeaway here is these 3 sites are our highest diversity, with Pine Run having 20 species, which is in the center. And Pine Run also had 2,000 individuals, which is a very high density of fish species for this stream. And then Sipes Run had 17 species and Watson Run had 14 species. The other 2 sites that we looked at were generally low diversity sites. These are also extremely small and hard to reach. So it's not that surprising that we found this result. So from all of that fish survey data, then I calculated the Ohio Index of Biotic Integrity because this is within the Ohio River Basin. So what this looks like is I assess metrics that focus on abundance through species richness and composition, life history characteristics like breeding guild, dietary and pollution ranges, and preferred watershed size. And then I take these characteristics and account for the drainage area of the stream that we were surveying at. And from there, I'm able to assign each metric a score of either 1, 3, or 5, with 5 being the closest to a pristine stream of that drainage size. And then finally, I sum all of the metric scores to generate an IBI narrative range, with very poor being the lowest and exceptional being the highest. So this is how I organize this table. The metrics are listed to the left. And again, the sites are at the top, and they'll be separated into columns with 2013 samples or results being on the left and 2021 being on the right. And this is really overwhelming right now. So don't worry so much about like trying to understand this table. What I want you to see is that this is how I analyze this data. And I also wanted you guys to see what the improvements are. So the green numbers are numbers that went up from 2013, metrics that increased, and red numbers are metrics that decreased. Also, I wanted to note that the 5s with asterisks are actually streams that are above the metric score. So they're like above and beyond exceptional. And so my main takeaway from these IBI results is, as seen in the blue box, that the IBI score has increased slightly at every site. And at Hessel-Gesser Run and Bell's Run, we actually saw an increase of 2 or more narrative ranges, which means that these increased substantially. And these are some of the metrics with overall increase. I'm going to dive into these a little bit closer in the next couple of slides. So we saw an increase in the number of minnow species that were present at these sites. So yes, Watson, Hessel-Gesser, and Bell's Run all increased, but note that Sipes Run and Pine Run remained above exceptional. So these, all of these sites are holding a high diversity of minnow species. And minnow species, or the minnow family, is the most diverse family of fish in freshwater streams in Pennsylvania. So we expect to see high numbers of minnow species in good quality waters. Next, I found less pollution tolerant fish in the fish communities. And what we did here was noticed that there overall was this trend of lower pollution tolerant density fish. Also, we found less pioneering species were present in 2021, meaning, well, pioneering species are the first species to colonize an area after disruption. So this is indicating that this community might be more stable. And overall, we saw more individuals per 300 meters. And this is a good indicator that these streams are healthy and can support high densities of fish. And so my overall takeaway and summary is that these streams have a healthy benthic habitat. We saw this through high numbers of darter and sculpin species, as well as high density and diversity across our 3 main high drainage area sites. And then according to the low pioneering species counts, we believe these watersheds might be in intermediate or climax communities. They may also just be hard for the fish to reach. These are also stable communities, as we could see with the IBI scores generally staying in the same narrative range. And so some of my next steps in this Buffalo Creek project are looking at environmental DNA analysis. And eDNA analysis is a conservation genetics tool to look at community structure. And what we do is we sample the water and extract all of the DNA out of this to come to conclusions about what creatures are living in the water, what DNA is being shed in the water. I also plan to conduct additional surveys and perform more biotic indexing on fish, macroinvertebrates, and diatoms, which are a type of algae. And then finally, I want to identify the unknown pollution sources by using water chemistry analysis through ion-coupled and ion-coupled plasma mass spectrometry. And finally, I'd like to acknowledge and thank all of the people who've helped me along the way. So.
All right, Kat, thank you very much for your work and your presentation. I'd like to open it up if there are any questions before we wrap up. Okay. Angela, do you have one?
I think it was over my head. Like I had some, and then it was great presentation. I'm afraid my questions are more rudimentary, so I will probably just email you another. It was great. It was great information. I didn't realize, and I am into like clean eating and fish and making sure there's not a high mercury count. So I didn't even realize a lot of stuff that you were talking about. So I really appreciate your presentation. Thank you.
I would love to hear what your questions are. I'm sure that you're not the only one with these questions.
I had questions like, when you shock the fish, does it hurt? How long does it, how long are they out for? Like I had like really rudimentary questions. It wasn't, and then I had questions about the data that you found, like, yeah, like what's the next process in that? And I had questions about the minnow population. It was a lot of little questions like that.
Yeah, so let me tell you real quick about the electrofishing process. So most fish have air bladders inside of them that help them regulate where they are in the water table.
Oh.
And so when you shock them, it's kind of like they hold their breath and they all end up floating up to the top of the surface. And then they just sort of like drift into our seine. And for some of the benthic fish, so the fish that stay under the rocks and hang out in those areas, we actually use our dip nets to get them because they don't have those air bladders and they stay at the bottom of the water.
So interesting. Okay.
Yes.
And then the research, yeah, go ahead.
Sorry, what was your next?
The research you're going to be doing, because you that big chart, the next steps, I missed what is the next steps after that?
Yeah, so the this is actually kind of a complete process right now. So the fish community is one aspect of all of the Buffalo Creek stuff that I'm doing. Okay. And then so the fish community assessments have already been completed, but now that I know what fish are in the water, I can go back there and take water samples and find out if the conservation genetics tool that we use in our lab is working at this site. So that's when I would be able to test the DNA in the water.
That is awesome. I'm learning so much today. Thank you so much.
Yeah, thank you.
All right. Well, we're reaching our time here, so we're gonna wrap up for the day. Thanks to everybody for participating in the GRS today. Hope you learned a lot. Hope you enjoyed the time, and I really thank everybody for their presentation. So take care. Have a good rest of the day.
Thank you, you too.